Hello everyone, I am Dr. Pallavi Deshpande, your friendly gynac. Today we'll just have quick learning about CA endometrium, that means carcinoma of endometrium, uterine cancer. What it is? This is our uterus and this is the inside layer of the uterus called as endometrium. The cancer of endometrium is the cancer of this inside layer of the uterus. Why we are talking about this cancer? This is the most common cancer worldwide of genital area in women. What is the risk factor whom this cancer get, or which are the patients who is susceptible for this cancer? First of all, nulli gravida, nulliparity. You have not given birth to any child. These are the patients who are prone to get this cancer. Obesity, obese patient. Third, patient is having diabetes. Fourth, unopposed estrogen therapy. A patient who is postmenopausal, they take hormonal replacement therapy, they are having more chances of getting this carcinoma. There may be genetic factors also, mainly Lynch 2 syndrome, which is having association with the carcinoma endometrium. And last one is drug therapy like tamoxifen used to cause the carcinoma endometrium. So now what patient present with? Mainly 90% of patients of carcinoma endometrium present with perimenopausal as well as postmenopausal abnormal PV bleeding. So any pervaginal bleeding, perimenopausal or postmenopausal, should not be neglected because it might be cancer endometrium. 5% of women might be having discomfort in your pelvis, but 5% of women are asymptomatic. They don't have any symptom. That's why this cancer is having very poor prognosis. The other thing, how to screen this cancer? Usually cervical cancer, that means cancer of the mouth of the uterus, can be screened easily by regular pap smear. So we can detect it early and treat it early. But this cancer cannot be screened regular basis. There is no any regular method which can be screen this cancer and detect it early. But USG sonography or the best screening or best diagnosis is by endometrial biopsy. But that cannot be feasible for each and every patient. So a patient who are at high risk, we can go for this screening. So now treatment of carcinoma endometrium depend upon your stage of cancer, and modalities can be vary from laparoscopic hysterectomy to exploration, lymph node resection, and post-operative radio as well as chemotherapy. So the best thing to prevent carcinoma endometrium is your education. So kindly educate you and your near ones. Thank you so much.